Today, I'm going to give an introduction to prosthodontics. Basically, prosthodontics is the branch of dentistry concerned with replacement of missing dental, oral, and craniofacial structures by artificial devices. The artificial devices used for replacement of the missing part of the human body that are dentures. There are branches in prosthodontics are fixed prosthodontics, removable prosthodontics, complete denture prosthodontics, partial denture prosthodontics, implant prosthodontics, and maxillofacial prosthesis. When a patient comes to you with edentulous condition, that is, the patient comes to you with no teeth present in his or her mouth, we give a prosthesis, or that is complete denture prosthesis. When it is partially edentulous, that is, some of the teeth is absent, we give removable partial denture prosthesis or fixed denture prosthesis or implant prosthesis. So there are different types of treatments in prosthodontics where the missing structures can be replaced to maximum and attain maximum aesthetics to the patient. When you come to the next slide, is the definition of prosthesis, prosthodontics, the area of dentistry pertaining to the diagnosis, treatment, planning, rehabilitation, and maintenance of the oral function, aesthetics, and health of the patient with clinical conditions associated with missing teeth, deficient teeth, or compromised maxillofacial tissues using biocompatible substitutes. When you come to general prosthesis, the term prosthesis is an artificial substitute for a living organ or part of the body. In this slide, you can see different prosthesis. One is the leg prosthesis, another is the ear prosthesis, and the third one is the eye prosthesis. Actually, prosthesis is a cubism. Making of a prosthesis is a cubism procedure, and wearing it is more cubism. So you can see in this the fourth slide, there are a lot. You can you, you, you just go through the fourth slide. You can see the prosthesis over there. There is a lot of mechanical connections are there, metallic parts are there, but we can make that metallic parts a little more aesthetic. We can give them little more aesthetic value. For giving this aesthetic value for the prosthesis, you can use silicon material to make this type lively prosthesis. So this prosthesis is an artificial substitute for a living organ or part of a body. Then basically when we come to dentures, there's the prosthetic devices constructed to replace missing teeth. This is a partial denture. There are different types of dentures, and the second picture shows a complete denture. A denture is placed when there is edentulism, where a completely edentulous mouth is replaced with complete denture prosthesis. When a patient comes to you without none of the teeth present, you do all the procedures to make a complete denture and you give the prosthesis. This slide shows a complete edentulousness where we can give, or the treatment what we can give is complete denture prosthesis. Next comes the different slides of, or you can see different photographs of different types of edentulousness: single teeth missing, multiple teeth missing, upper and the lower arches, where we can give removable prosthesis or fixed partial denture prosthesis. For removable prosthesis, as I told you before, there are different types of removable prosthesis that is made of, it can be made of acrylic, it can be flexible dentures, or it can be cast partial dentures. So these type of edentuliousness, partial edentuliousness can be treated with uh, removable partial denture prosthesis and, if possible, fixed partial denture prosthesis. Or higher version, when you go to implants, when the conditions are favorable in all, especially the oral conditions and the general condition of the patients are favorable, we can go for implants. When you come to the forms of prosthesis, that the complete denture prosthesis, removable partial denture prosthesis, partial denture prosthesis, implant prosthesis, and maxillofacial prosthesis. These are the different forms of prosthesis. When you come to removable complete dentures, you can see in this slide, it's a complete denture where the upper and the lower member is there. Hold all the teeth. When a patient comes with none of the teeth is present or all the teeth is missing, we can give a treatment like this. That's the removable complete dentures. When you come to removable partial dentures, that's commonly called as RPD. There are, as I told you before, there are different types of RPDs. Cast partial dentures can be given, acrylic dentures can be given with clasps, then flexible dentures also can be given in certain cases. When you come to fixed partial dentures, in this you can see this is a 3-unit diagrammatic representation of a fixed partial denture. In this a 3-unit, in the middle one is the pontic, and both the other tooth are the abutments, where these prosthesis or fixed partial denture is connected to the abutments, which is seen where the um, it comes from the prepared tooth. What is where this process FPD is to be fixed with the help of cements. So this is fixed partial dentures, where a single tooth is missing. And this is another photograph of a fixed partial denture. This is also a 3-unit um, bridge where the both ends are abutments, or the crowns which is to be placed on the abutments below, and in the middle it is the pontic where it replaces the missing structure. Then when you come to implants, you can see in this representation or the photograph, there is a metallic part inside the bone. You can see the neighboring tooth, which where the root is being embedded in the bone as natural. So we can give a natural type of process, very natural type of processes, by placing an implant inside the bone and allow it to heal, where the bone gets grown. That's the by osseointegration procedure. The bone grows, into the implant or onto the surface of the implant. It get intact, very intact, and it's highly stabilized inside the bone. Then we can place a prosthesis over it. A tooth is placed with the help of abutment connectors and different procedures after making um, impressions, we can place tooth over the implants. That's the implant retained prosthesis or implant prosthesis. When you come to maxillofacial prosthesis, as in the first slide, you saw all the one or two maxillofacial prosthesis. That was the leg prosthesis and the ear prosthesis, and uh, like that you can see the ear prosthesis which is made of silicon. Silicon gives a very natural appearance, and the next slide shows the silicon nose, and the third one shows the eye prosthesis, which eyelids where it is attached to it, and it seems to be very natural. In this maxillofacial prosthesis, you can see two photographs. There's the before the treatment and after the treatment. You appreciate the natural feel of the processes, how much it is been naturally intact with the other oral structures of the face. Almost one fourth of the oral structure is missing in this, and both the eyes are not there, and the nose of the part of the nose is missing. This can be because of some injury or some war injury or some accidents or some cancer. Usually, this happens for some in cancer patients where surgery is this cancer has been involved in. It has been pro- gone to different aspects or different sites, especially the eyes, the nose, and the interior structures over it. So what we can give is the natural look by silicone prosthesis. Next slide, you can see the part of the nose is being made by silicone. This can also this has also happened because of some accidents. You can see the silicone prosthesis which is being placed over the nose, and it gives a natural look. Next is the maxillofacial. Next maxillofacial prosthesis is the ear prosthesis. See how much natural the ear is being placed onto the defect. This ear is a prosthesis which is being fitted onto the implant, where is very intactly placed onto the patient with the help of implants. There are different types of maxillofacial or ear process which can be placed onto the patient with the help of implants or magnets or like that. A lot of different types of processes are there. In this, implants are being used to get an intact contact or perfect contact of the processes onto the patient. In this slide, you can also appreciate ear processes, which is also intactly or permanently, or I mean, it's not permanent, basically, it is intactly placed onto the implant, which is underlying, which has been placed onto the bone, available bone on that region, and an ear silicone processes is being placed. In this slide, you can appreciate the part of the nose has been placed, and so see the natural effect or how much natural that patient seems or sees when and his self-confidence. A lot of them, especially in this maxillofacial process, especially on the face, the defects on the face. When we give a silicone prosthesis, the patient's mental attitude changes. He or she will attain that confidence to interact with the public. And there's another ear and nose prosthesis. So naturally, it is being placed onto the structure inside, or it has been attached to the permanent structure, which is been especially that's a denture, the part of a denture which is being attached by magnets, and this prosthesis, with the help of magnets, has been attached onto the defect. Then comes the overdentures. There are different types of overdentures, the tooth supported overdenture and implant supported overdentures. Usually now it's very commonly seen is implant supported overdentures. When a patient comes to you, especially on the lower aspect, upper the dentures will with the help of suction or with the help of, because a lot of area is there for the upper denture to be to get stabilized onto the upper edentulous arch, but in the lower where almost all the structures, the tongue, the cheek, the lips, everything will interfere, so there are chances of the lower denture to get displaced. So when you go for when you do an overdenture implant supported overdenture treatment, that gives a very that value of the denture is increased, the patient satisfaction is increased. So you can think of overdentures with implant supported. In this, there's a photograph where two implants has been used for the support of the lower prosthesis. Then, as I told you before, there's the cast partial dentures, and this cast partial dentures are seen. That's a metallic framework is there over it, acrylic, and tooth is being placed where the framework has got clasps where it has been attached to the or attached to the neighboring tooth for the stability. When you come to full mouth rehabilitation, this is a case of full mouth rehabilitation where all the teeth has been aesthetically placed or functionally placed well, so we'll get a good um, aesthetic value. We can give a very good aesthetic value to the patient. This is a full mouth rehabilitation. In a full mouth rehabilitation case, where all the teeth has been can be given like this, and these the these are the different aspects which you saw how a prosthesis can be given and the importance of prosthodontics to the public where we can give a very good treatment. Thank you for your patient listening. Thank you.